Hi, good morning. My name is Dina Benjamin. I am a nursing student from St. Thomas University. Today I'm here to do a general head-to-toe assessment on you. Is this a good time?
Yes.
Okay, so the head-to-toe assessment is going to take about 15 to 20 minutes. Do you have to use the bathroom?
No.
Okay, do you have any allergies?
No.
All right, before I start the head-to-toe assessment, I'm just gonna go wash my hands quickly. I'll be right back, okay? So I wash my hands, and when I come back, I'm going to check your band. Can you state your name for me?
Brenda Benjamin,
Your date of birth?
061697.
Do you know what year we in?
Yes. 2020.
Okay, and who's our current president?
Donald Trump.
Okay, so my patient is alert, awake, oriented times 3. So before I start the head-to-toe assessment, I'm just going to take a general look at her appearance. She's well-groomed. She's properly dressed for the doctor's office. So we're going to get started with our head-to-toe assessment. So the first thing I'm going to do, I'm going to start with her head. I'm going to palpate her head. I'm looking if she have any bruising, any scars, or any any redness, and I'm going to also palpate, and I'm going to ask my patient, do she feel any pain? Do you feel any pain?
No.
Okay, her head is normal cephalic. It's not too big, it's not too small. It's equivalent to her body. So the next thing I'm going to do, and I'm going to look at her ears. Her ears are symmetrical, and with my pen light, I'm going to look inside of her ears to see if she have any excess drainage, any fluid coming out, or any redness. So whatever I do to one ear, I'm going to do to the other ear. So I'm going to look inside of her ears, and she's over 3, so I'm going to pull her ears up and back. So I'm checking inside of her ears. I don't see no excess drainage. I'm checking behind the ears for any bruising. There's no bruising. And I'm going to do the same things to the other ear. Up and back, no excess drainage, no redness, no bruising. I'm going to palpate her tragus, and I'm also going to ask her if she feel any pain. Do you feel any pain?
No.
Okay, so now I'm going to check her cranial nerve number 8, which is acoustic. So what I'm going to do is I'm going to whisper 3 things in your ears, and I want you to repeat it back to me, okay?
Car, house, boat. Yellow, green, blue.
Okay, so she was able to repeat everything back to me, so her cranial nerve number 8 is intact. The next thing I'm going to do, I'm going to assess her eyes. I'm going to pull down the conjunctiva. Okay, the conjunctiva should be pink. Okay, her eyes is symmetrical, her eyelids is equal. She don't have any scars, no bruising. So with my pen light, usually I would have to turn off the lights to dim the light in order to see her pupils in the light. So we don't have time to do that, so I'm just gonna do that like this. So I'm going to bring the pen light to her eyes. Her pupil should dilate, and I'm going to do the other one for the same eyes. Pupils dilate. And while I'm here, I'm going to check cranial nerve 346, which is oculomotor, abducens, and the occlear. So what I'm going to do, I'm going to do the 6 quadernal points of gaze. I'm going to ask my patient to follow the pen light with her eyes and not with her ears, and we're checking if she have any strabismus or nystagmus. So just follow this each corner with your eyes and not with your head. Okay, she was able to follow all the coordinates, so her cranial nerve 346 is intact. The next thing that I'm going to do, and I'm going to assess her nose. Her nose is symmetrical. She don't have any deviation. I'm going to check the inside of her nose. Her nostrils should be pink and moist. There shouldn't be any redness or anything. Okay, I don't see no excess drainage. So the next thing I'm going to do, I'm going to ask my patient to put one finger over her nose, and I'm going to ask her to breathe in and out, and do the other one. Okay, so I was checking the patency of her nose to see if she have any obstruction. So the next thing that we're going to do, we're going to check cranial nerve number 1, which is the olfactory, and I would ask my patient to smell 2 things, and then she would distinguish what are the 2 different smells. Okay, so the next thing that I'm going to do, I'm going to assess her mouth. Her lips should be pink and moist. I'm going to ask her to open her mouth for me, and we're going to check cranial nerve number 9, which is the vagus nerve. And I would usually use my tongue blade to go in the back to check her gag reflex. So I'm checking the inside of her mouth. She don't have any missing teeth. Her palates are intact. Stick your tongue out for me. And I'm going to ask her to move her tongue side to side, and we're checking cranial nerve number 12, which is the hypoglossal. I'm checking the inside of her mouth. It's pink and moist, no missing tooth and anything like that. Okay, so the next thing I'm going to do is I'm going to check cranial nerve number 7, which is her facial nerve. So I'm going to ask you to puff up your cheeks. Okay, raise up your eyebrows. Okay, you can smile for me. You can frown. Okay, so she was able to do everything, so her cranial nerve number 7 is intact. The next thing I'm going to do, I'm going to move to her neck, and with her neck, I'm going to check her carotid pulse. They're both +2. They're both +2. And with my stethoscope, with the bell of my stethoscope, I'm going to auscultate for bruits. Okay, so I was able to hear that whoosh sound, so everything's intact. The next thing I'm going to do, I'm going to do her heart. So I'm going to start with the right side, which is the aortic. So I'm going to ask her to breathe in, out, pulmonic, breathe in, out. I'm going to Erb's point, which is where you hear S1 and S2 simultaneously. The aortic and the pulmonic are the S2 sounds. And then I'm going to auscultate S3 and S4, which is the tricuspid and the mitral valve. And at the S4 sound, that's where you get your point of maximal impulse, and that's where you will get your apical pulse and listen to it for 60 seconds. So I'm going to ask her to, it's okay, breathe in and out. Breathe in and out. Okay, so I was able to hear her heart sounds. I don't hear anything abnormal. So while I'm in the front, I'm also going to listen to her lung sounds with the diaphragm of the stethoscope. I'm going to ask her to breathe in, out, breathe in, out. And I'm also going to do the back of her lungs. Breathe in, out, breathe in, out, and out. So her lung sounds were normal. There were no wheezing, no stridor, or anything like that. The next thing I'm going to do, I'm going to check cranial nerve number 11, which is the accessories. So I'm going to ask her to put your shoulders up. Okay, I'm going to ask you to go against my strength and resistance. Okay, she was able to do that. The next thing I'm going to do, I'm going to move down to her abdomen. Before we start the assessment, I'm going to ask you, when was the last time you had your bowel movement?
Yesterday.
Okay, do you have any difficulty when you use the bathroom? Okay, so I'm going to inspect her bowels. And the next thing I'm going to do, I'm going to auscultate her bowel sounds. I'm going to auscultate all 4 quadrants for 30 seconds. And if I don't hear any bowel sounds, I'm going to auscultate each quadrant for 5 minutes. So we're going to start with the lower left. Okay, so her bowel sounds are normal, active. The next thing I'm going to do, I'm going to check all her pulses. I had already checked her 2 carotid pulse. I'm going to check her brachial pulses. I'm going to check her ulnar pulse. Everything is +2. I'm going to check her radial pulse. I would check her femur pulse, which is right here, her popliteal pulse, which is right here, her dorsus pedalis, which is right here, and the ones back here, which is I forgot. Okay, so the next thing that I'm going to do is I believe I assessed everything with my patient. I asked her when was her last bowel movement, and the next thing, since she's a woman, I'm gonna educate her about getting her normal her pap smears every year. Ask her about her menstrual cycle. Do she have a regular menstrual cycle? And that concludes our head to toe assessment. Thank you.
Great.